Things We Do for No Reason in the Hospital Setting Part 2. I unfortunately did not come up with this catchy title. It's a series published in the Journal of Hospital Medicine that I love to talk about on this page that typically talks about things that we do in medicine, specifically in the hospital, that aren't rooted in evidence or medical science, but are more just based on tradition. This particular one is about treating infection-related fever in the hospital as a blanket rule. If you've ever worked in a hospital, you know this is a pretty common practice. Most admission order sets do contain a Tylenol PRN order for both pain and fever. There's often what this article calls fever phobia in the hospital, this idea among clinicians that fever is inherently noxious to the body and something that we should be treating. But what the science actually says is that fever is an adaptive, helpful response to an infection. And we know that, for example, it helps promote immune functioning. It helps promote mobilization of leukocytes. It helps promote proliferation of T cells. And multiple studies have actually shown that the use of antipyretics like Tylenol or NSAIDs interfere with the body's immune response to infection. This has been shown for numerous types of infections, anywhere from rhinovirus to malaria. Now, obviously, fever can be really uncomfortable. It can cause headaches, body aches, sweats. And if those things are happening and they're bothering the patient, of course, you should give them Tylenol if there's no contraindication. But what this article really points out is that we probably should let more fevers ride in the hospital. We should allow for permissive fever in patients who are experiencing no or minimal symptoms. Disclaimers, this does not apply to hyperthermia, completely different clinical entity. There also may be some nuance in treating patients who are unstable with septic shock in the ICU, but this is for most general inpatients. The bottom line is that we don't need to be using Tylenol to reduce fever as a general rule without putting some active thought into whether that would actually benefit that particular patient. Anyway, let me know if you have a request for part 3.